The objectives of this presentation are to, number one, understand coronary heart disease, CHD, in women, also known as coronary artery disease, identifying the physiologic impact of menopause, awareness of the risks and benefits of hormone replacement therapy, HRT, and also knowing how to decrease your risk of coronary heart disease after menopause. Coronary heart disease, or coronary artery disease, is a narrowing of the small blood vessels that supply blood and oxygen to the heart. CHD in women. It is the number one killer for women in America over age 65. Women are more likely to die from a heart attack than men, but why? Well, for one, women have atypical symptoms that may make diagnosis and treatment extremely challenging. Ovarian function, which is diagnosed after 12 months of amenorrhea or loss of period. Hormone changes include decrease in estrogen and progesterone, which is the protective mechanism on the heart, specifically the estrogen. The uterus may become smaller, and manifestations of prolapse of the reproductive or urinary tract organs may occur. Some symptoms of menopause. So we had to make this slightly comical. So we have the 7 dwarfs of menopause: grumpy, sleepy, itchy, sweaty, bloated, moody, and forgetful. But in reality, menopause can be very uncomfortable for many women. It can cause such things as hot flashes, mood swings and irritability, low energy, weight gain, loss of libido, which is sex drive, night sweats, irregular periods, bone loss, and sleeplessness. Also known as osteoporosis. So you can see in the picture below the difference between what healthy bone looks like and bones that have osteoporosis. So bone density loss. Besides protecting the heart, estrogen also protects bone strength, and in which case you may develop osteoporosis. Loss of 10% of bone mass during the menopause transition may occur. Most bone loss occurs 1 year before and 2 years after a woman's last period. So what do we do to protect ourselves? Proper diet and exercise, supplements of vitamin K and D as necessary, and there are blood work and blood testing that can be done to determine whether or not you are vitamin deficient, and your general practitioner would usually provide you with this testing. And also bone density testing is something that they can perform if they feel like there might be an issue. Kayla will also be discussing osteoporosis in the next presentation next Friday. We're also looking at cholesterol levels, because what happens is, as we discussed earlier, estrogen has a protective mechanism for the heart. When there are lower levels of estrogen, it can impact the amount of cholesterol that builds up inside the artery walls, causing the narrowing. So the overall cholesterol numbers that you want to aim for as an adult are 110 to 199, triglycerides 40 to 149, HDL, which is known as the good cholesterol, 50 to 70, and LDL, which is the bad cholesterol, should be 70 to 129. As you can see in the picture up on the right-hand side, the normal artery is all clear with no plaque buildup. And in B, narrowing of the artery, you see that there's an abnormal blood flow due to plaque buildup on the upper portion of the artery wall. In the previous slide, it actually increases levels of total cholesterol, LDL, bad cholesterol, and triglycerides. And with those increases, it results in lowered levels of the good cholesterol, or HDL. Estrogen is believed to have a positive effect on the inner layer of the artery wall, helping to keep the blood vessels flexible. The decrease in estrogen can cause stiffening of these walls, making it challenging to accommodate blood flow. Elevated blood pressure, secondary to hormone shifts, also may occur. Key risk factors are typically the same as key risk factors for heart disease in general. Hypertension, which is uncontrolled blood pressure, dyslipidemia, which is issues with your cholesterol levels, obesity, or being overweight, diabetes, and smoking. Smoking cessation is highly encouraged. Normal blood pressure is a systolic blood pressure less than 120 and a diastolic less than 80. Now, when we're discussing systolic versus diastolic, the systolic number is the number on the top, which demonstrates the blood pressure of the heart when it is contracting or pumping the blood. And the diastolic number, the number on the bottom, demonstrates blood pressure when the heart is not pumping, basically when the heart's at rest. Elevated blood pressure is categorized between a blood pressure reading at rest of 120 to 129 and less than 180. High blood pressure, which they're considering hypertension stage 1, is a systolic reading of 130 to 139, and or diastolic numbers between 80 and 89. High blood pressure hypertension stage 2 is 140 or higher, and 90 or higher, and hypertensive crisis, which is an emergency. That's why it says consult your doctor immediately, is for systolic blood pressures higher than 180 and diastolics higher than 120. Now, your physician knows where your blood pressure runs, so everybody's blood pressure is a little different, and they will help to guide you in treatment plan. So the risks of hormone replacement therapy is an increased risk for coronary heart disease. So it is discouraged for women that have already had a history of issues with the arteries surrounding their heart. Increased risk of breast cancer. So anybody that's had cancer in the past, chance of blood clots, and increased risk of stroke. The benefits of hormone replacement therapy include protection against osteoporosis, which we discussed earlier, improved muscle strength, improvement in hot flashes, and better sleep patterns. What is the alternative to hormone replacement therapy? Cardiac rehab. Exercise training is often considered the cornerstone of non-pharmacological therapy for postmenopausal women. Evidence shows that physical activity can be used instead of hormone replacement therapy to improve menopausal symptoms, including changes in estrogen metabolism, or basically the breakdown of estrogen in the body. The American Heart Association advises against the use of hormone replacement therapy. The American College of Cardiology considers it a Class 3, which means not useful or effective and may be harmful for primary and secondary prevention of coronary heart disease. Weigh the risks and benefits. Lowest dose for the shortest duration. Contraindications include women with history of breast cancer, heart disease, previous DVTs, which is a deep vein thrombosis, stroke or TIA, active liver disease, and those that are at high risk for endometrial cancers. Keeping your heart healthy will aid in assistance with menopausal symptoms. So some of the things to do that will help with both is maintaining a healthy weight, exercising for 150 minutes per week, proper nutrition, which is what we talk about here in several other of our classes, plenty of fruits and veggies, whole grains, low-fat dairy products, limiting your meat intake to poultry, fish, and nuts, which is your healthy proteins, and watching out for the red meats, avoiding sugary foods and beverages, managing diabetes if you have diabetes, managing high blood pressure and high cholesterol. And again, there are several lab tests that your doctor may or may not perform based on what you have in your history to help you and guide you in determining your progress in your health. Diabetes management includes oral agents, insulin, and checking what we call your A1C level, which is a blood test to see how well your diabetes is doing. Also, smoking cessation is very important. If you happen to be a smoker, we have several options for you here to help you and guide you. We have a smoking cessation counselor, and we also have a behavioral therapist that can help you with your goals. Study of women's health across the nation. In this study, more than 1,100 women between the ages of 42 and 52 participated in a study regarding a healthy lifestyle during the menopausal transition. Healthy lifestyle scores, HLS, were used as assessment data. And some of these things that they scaled included smoking, physical activity, diet quality, which is as quantified by a healthy diet score. The results were that they found that women who have a healthier lifestyle, defined by the abstinence from smoking, eating a healthy diet, and engaging in regular physical activity during their midlife or menopausal transition period, have lower levels of subclinical arterial sclerosis later in life. And arterial sclerosis is just the fancy word for coronary heart disease. Thank you very much, and I hope you enjoyed this presentation. My name is Justine. I work in the women's group at 2 p.m. If you have any questions regarding anything you saw today, please feel free to come up and see me. Thank you so much, and enjoy your day.